walk in, provide privacy, hand hygiene. Hey, my name is Caitlin and I'll be your nurse today. Can you verify your name and date of birth for me?
Danielle Shank, 3697.
Okay. All right. Do you have any allergies that I need to know about? Okay. Well, I'm going to do a respiratory and cardiac assessment on you, if that's okay.
Yes.
All right. Start with respiratory. Do you have you had a shortness of breath or a cough or anything recently?
No, ma'am.
No? Okay. Well, I am going to start by taking your respiratory rate, okay? All right, that was 18, even and unlabored eupnea, so that's good. All right, I'm gonna listen to your lung sounds, okay? So I'm gonna do 4 anteriorly, 4 posteriorly, and 2 lateral. So I'll start here, and it will be her right upper, and then I'll go to left upper, then I'll go down to left upper again, right middle, and then I will go to right lower, and then her left lower, and then I'll move to her posterior. All right, if you'll lean up for me. All right, and for the sake of the video, I did it on top of the shirt, but in a real assessment, you would do it stethoscope to skin, and there was no adventitious breath sounds. Everything seemed clear and normal. Now, have you used an incentive spirometer before? You have not, okay? So here's your incentive spirometer. If you will, breathe in, take a deep breath in, and then let it out. And so what this does, you do it 10 times every hour that you're awake. And what it does is it expands your lungs and it helps prevent pneumonia. And then you can also turn, cough, and deep breathe, and that clears your lungs out and also is a prevention of pneumonia as well. Okay, so that concludes the respiratory assessment. Now I'm going to move into cardiac. Have you had any chest tightness or pain within the chest? No? Okay. I'm going to start with JVD. If you could just slide down a little bit in your chair, and I will get her at a 45-degree angle. And turn your head that way for me. Everything looks good here. No JVD is present. Turn your head this way. No JVD is present there as well. All right, I'm going to check for capillary refill, and this is to check for blood flow. All right, and the color returns in less than 2 seconds, so that's good. Now, I'm going to check your pulses. So I'm going to start, and I'm going to check her radial pulse bilaterally. and her pulse was 68 radial, regular, and it was a 2+, so that's good. Then I'm going to go to her posterior tibial pulse, and I would check that bilaterally as well. And then her dorsalis pedis, I would check that bilaterally as well. Okay, and then up here we have her carotid pulse, we have her axillary pulse, her brachial pulse, I assess her radial, her femoral pulse, behind the knee is her popliteal pulse, and then you have her posterior tibial and her dorsalis pedis. All right, so I'm going to listen to your lung sounds now, your heart sounds now, if that's okay. So starting on this side, I have her aortic in the second intercostal space on the right, and then her pulmonic is in the left second intercostal space. Her Erb's point is in the third intercostal space. The tricuspid is in the fourth intercostal space, and the mitral is in the fifth intercostal space, mid-clavicular, and it is also the apex of the heart. So I'm going to listen to those, and again, in a real assessment, you would do this stethoscope to skin, but for the purpose of this video, I'm just going to do it on top of her shirt. And if I were to hear anything that sounds incorrect or like it shouldn't be there, I would flip it over and I would use the bell of the stethoscope to listen to any murmurs or S3, S4 sounds. But for her normal sounds, I will use the diaphragm of the stethoscope. Okay, everything sounds good there. And then, so that concludes our cardiac assessment. And now we're going to talk about safety. So for her, safety, some fall risk assessment, she has visual impairment, which could lead to a fall. And she is also on medications that could put her at risk for falling. So I'm going to ask you a few questions in relation to your fall that you recently had, okay? Have you, what happened? When did you have a fall recently?
I fell at work.
Okay. So when you're getting around, can you walk on it any way?
Yeah, I just hold on to the furniture.
Hold on to the furniture. So what did it hurt? Did it mess up your ankle, your leg? What is it? Your leg. Okay. So for safety purposes, what she could do is, this rug is a safety hazard right now. She would need to clear her house of rugs, or at least put them closer to a wall so she doesn't have to walk on them all the time. And with her case, with her having a fall, she would want to put them up. And then the toys that are scattered around the room, she would also want to put those back in place to prevent any more further falls. Do you have any questions? No questions? All right, well that will conclude our assessment today.